Thank you for joining us today for the Legally Responsible Individual as Participant Direct Services Employee training. This training will be designed for our providers, and also it will be shared amongst our providers later on today or this week. So today for our agenda for our training, first we'll give a quick overview of the new process and why it is necessary. We're going to define who is considered an LRI and take a closer look at the reasons for allowing LRIs to be hired as their role as a PDS employee. Next, we'll review CMS requirements for defining extraordinary care and also how Kentucky defines it. Finally, we'll show you how to enter an LRI review request in the Medicaid Waiver Management Application System, MWMA. Implementing an updated LRI review process. Why implement an updated LRI review process? First and foremost, to comply with Centers for Medicare and Medicaid Services requirement for the 1915C Home and Community-Based Services Waiver, states are not required to allow legally responsible individuals as participant direct services employees. When a state chooses to allow LRIs as PDS employees, CMS requires states to put safeguards in place to ensure the participant direct services employee is providing extraordinary care and to protect participants who are receiving services from someone who is also responsible for the participants' financial interests. Prior to COVID-19, the public health emergency, the review process varied across all 6 waivers. Since the review criteria is not population specific, all waivers should be consistent in that process. There are many LRIs currently working as PDS employees who have never been reviewed. Any LRI PDS employee for acquired brain injury long-term care, or Michelle P. participants must be screened, as these waivers did not have a screening process prior to COVID-19 public health emergency. DAIL and DMS waived the review process to expedite PDS hirings and help participants cope with the pandemic-induced staffing challenges. With the public health emergency over, these workers must be screened to continue working permanently. We will go through which LRIs require that review and which do not in a few minutes. Beginning July 1st of 2024, DAIL and DMS will begin using a new review process for hiring legally responsible individuals, or LRIs, as participant direct services or PDS employees. We'll look closer at the full LRI definition in a minute, but LRIs generally include parents of minor children, spouses, and court Kentucky appointed guardians. When the new process takes effect, it will no longer be completed using the paper forms as it was before COVID. The new process will be completed entirely in the Medicaid Waiver Management application. The case manager will assist the participant and/or participant direct services representative in answering the review questions and entering the responses into MWMA. If a participant wants to hire a legally responsible individual before July 1st of 2024, the LRI conditional employment letter should be completed and uploaded to MWMA. The LRI may begin working, but will be screening at the time of the participant's next waiver level care recertification. So if an LRI is hired between May 1st of 2024 to June 30th of 2024, the case manager and the participant or participant's rep will complete the LRI conditional employment letter and upload that to MWMA. Allowing LRIs as PDS employees. So up next, we will look at who is considered a legally responsible individual. Under our new criteria, who is considered a legally responsible individual? For a minor child, a legally responsible individual is a parent, step-parent, adoptive parent, or Kentucky court-appointed guardian. Per state law, a guardian for a minor is an individual, agency, or corporation appointed by the district court to have care, custody, and control of a minor to manage their minor's financial resources. For an adult and legally responsible individual is a spouse or court-appointed guardian. Per state law, a guardian for an individual is a person appointed by the court to make decisions regarding the person of an adult. We do want to make a note. Foster parents cannot be hired as a PDS employee. Foster parents receive a per diem from the state for providing care to a child, and there are supplemental per diem rates for those caring for a child with a disability. We have a letter linked on the Department for Medicaid Services Participant Direct Services website with more information. If a participant wants to hire a PDS employee who falls into one of these categories, they must be reviewed. Under the previous process in HCB and SBL, any immediate family member required a review under the updated process. If the participant chooses to hire a family who does not fall into one of those categories above, they do not have to be reviewed. Allowing legally responsible individuals as participant direct services employees. Here's a couple examples that we will look at now. An adult participant direct services employee is hiring their parent. The parent is not the participant's court-appointed guardian. Does the parent require a review? That review would not be required. In this case, the participant is not considered the legally responsible individual because the participant is 18 years or older and the parent is not the guardian, therefore does not have the legal authority over the individual. A minor PDS employee hiring a grandparent. The grandparent is not the participant's court-appointed guardian. Does that participant require a review? No. That grandparent is not considered a legally responsible individual because they do not have the guardianship and therefore have no legal responsibility for that child. If the grandparent were also the minor's court-appointed guardian, a review would be required. Finally, a minor PDS hiring a sibling. That sibling is the participant's court-appointed guardian. Does the sibling require the review? Yes. The sibling, as the court-appointed guardian, is the legally responsible for the participant and must undergo that review process. Allowing legally responsible individuals as a PDS employee. In many cases, a legally responsible individual is the most appropriate person to deliver the waiver services. This is often due to the participant's care needs combined with the lack of available providers who cannot meet the participant's needs. The participant's geographic area and the number of providers available in that area and/or the legally responsible individual's ability to maintain employment due to the participant's care needs. Allowing LRIs gives participants and their families flexibility in finding a care plan that works. It is important to note for payments to comply with CMS requirements, they should only be made when the legally responsible individual is determined to be the most appropriate participant direct services employee, when the services delivered are above and beyond what is typically provided to someone of the same age, and when services are delivered in the timeframe outlined in the person-centered service plan. Except for their relationship to the participant, the legally responsible individual participant direct services employee is the equivalent of a traditional agency direct service worker and should be reimbursed as such. Payments to legally responsible individual participant direct services employees are not intended to provide financial assistance or to be a source of income. Per the CMS State Medicaid Manual, legally responsible individuals cannot be paid when the services are those that these persons are already legally obligated to provide. Next, let's go over the review requirements, as there are some variations based on the legally responsible individual hire date. For any legally responsible individual hired on or after July 1st of 2024, they will undergo the review process at the time of the hire and before they begin work. For legally responsible individuals hired who have never been reviewed, they will undergo review at the time of the participant's recertification for level of care. This includes any legally responsible individual participant direct services employee in acquired brain injury, acute acquired brain injury long-term care, and Michelle P. Waiver hired before March of 2020. The legally responsible individual participant direct services employee hired during COVID, public health emergency, and the participant direct services legally responsible individuals hired between May 1st of 2024 and June 30th of 2024. No review is required for legally responsible individuals who were approved under the previous process that was in place before COVID, public health emergency, and of course, any participant direct services employee who is not a legally responsible individual does not need to be reviewed. Next, we will define extraordinary care. As we mentioned before, per Centers for Medicaid and Medicare Services, allowing the legally responsible individual to be paid as a PDS employee is not a federal requirement. States can choose whether to allow the legally responsible individual to be hired by waiver participant. When a state allows the legally responsible individual to be a PDS employee, as Kentucky does, CMS requires us to ensure the legally responsible individual is being paid for extraordinary care. This goes back to a couple of moments ago, where we referenced the state Medicaid manual, which states the legally responsible individual cannot be paid for services they are legally obligated to provide. CMS defines extraordinary care as the care exceeding the range of activities that the legally responsible individual would ordinarily perform in the household on behalf of a person without a disability or chronic illness of the same age, and which are not necessary to assure the health and welfare of the participant and avoid institution. Historically, Kentucky used the CMS definition, which is broad and did not clearly define which situations qualify as extraordinary care. The updated review process will use a defined definition meant to clarify the circumstances considered extraordinary care. When developed, a definition of extraordinary care that considers the age of the individual hiring the legally responsible individual PDS employee. This is because the range of activities a legally responsible individual must assist a child, which is greater than what they would assist an adult with. First, we'll look at the criteria for participants who are minors. For minors who want to hire a legally responsible individual, there are two categories. The minor must at least meet one of the categories in category A and at least one of the criteria in category B for the legally responsible individual to receive approval. For adults, the process only includes a single category. The legally responsible individual only has to meet one of those criteria. Up next, we will start to look at the legally responsible individual's employee request in the Medicaid Waiver Management Application System, MWMA. To enter an LRI employee review request, you will go to the participant's individual summary screen and select View PDS Employee from the menu on the left. One important tip, only individuals with a case manager or case supervisor role in MWMA can submit a legally responsible individual employee review request. Once you are on the Related Employees landing screen, you have two options there in green. Add employee approved offline. If the participant has the LRI PDS employee who underwent the review process for HCB or SCL prior to March of 2020, please use this option to add them. They will not be reviewed again. However, we do want to be sure that they are recorded as an approved employee in MWMA. Create a new associated employee. This would be there for step 2. Use this option to add a new PDS employee. This includes the participant direct services employee hired on July 1st of 2024 or later, and any legally responsible individual participant direct service employee who has never been reviewed before. This screen also shows you the status for each participant direct services employee, whether they're a pending review or the review is in progress or they have been approved. Let's start with looking at how to enter information for the legally responsible individual PDS employee who has already been approved. After selecting Add Employee Approved Offline, this screen will appear. Here you will need to add the following information for the legally responsible individual participant direct services employee. Legal first name, legal last name, date of birth, last 4 digits of the employee's SSN or Social Security number. Next, you will select yes to the next question. Is the employee a legally responsible individual? Then use the relationship type drop down to select the legally responsible individual relationship type. There is a required drop down for additional relationship type. You would use this for the LRIs, such as a guardian. For example, if the LRI relationship type for a minor child is a guardian, and the guardian is also the grandparent, you would select guardian of a minor child for the LRI relationship type, and grandparent for the additional relationship type. If there is no additional relationship types, like the example on the screen, where the LRI is the parent of the minor child, then you select no relation in additional relationship type dropdown. Finally, you must upload the legally responsible individual participant direct services employees approved MAC 532 from using the add new document. This is also required, and you cannot submit the request until the document is uploaded. Once you've completed all the fields, select submit request. Again, this is for the LRI PDS employee who have been reviewed and approved before March of 2020 for the home and community-based waiver and supports for community living. These individuals are considered approved and will not be re-reviewed. So, for a minor, the participants will go through and enter two categories. Category A is the first three boxes that you will come to, and the bottom two boxes are known as Category B. And this applies to a minor child participant under the age of 18. So for Category A, we will look at both Category A and B on the next slide. For Category A, and again, this is for the minor under the age of 18, one of the categories criteria will have to be met. The child's care needs have reduced or eliminated the legally responsible individual's ability to maintain paid employment for the past 12 months or longer, and there's no alternative caregiver who's functionally able to provide care. Number two, the legally responsible individual can demonstrate attempts within the first 30 days to recruit a qualified provider, traditional or participant direct service, but cannot secure one. And criteria number three, the minor child has a communication barrier exceeding his or her age-matched peers that impact his or her ability to effectively communicate the needs or wishes. Again, for a child, it's one of those in Category A plus one of the Category B. The child's dependency in performing activities of daily living must be directly related to his or her disability and exceeds that of their age-matched peers, or the child demonstrates destructive or injurious behaviors exceeding his or her age-matched peers, and such behaviors represent a risk of serious injury or death to others. And again, the minor must meet one of the categories in A and one of the criteria in Category B for the legally responsible individual to be approved. Now we'll take a look at the legally responsible individual for adults. And this is going to be for age 18 and above. And it is the three categories. The adult participant situation must meet one of the criteria for the legally responsible individual to be approved. And we will look at those criteria, and they are actually the criteria Category B or A. I'm sorry, A. The participant's care needs have reduced or eliminated the legally responsible individual's ability to maintain paid employment in the past 12 months or longer, and there is no alternative caregiver who is functionally able to provide care. The legally responsible individual can demonstrate attempts within the first 30 days to recruit a qualified provider, traditional or participant direct services, but cannot secure one, and the participant has a communication barrier exceeding his or her age-matched peers. that impacts their ability to effectively communicate needs or wishes. Adult participants' situation must meet one of the above criteria for the LRI to be approved. The legally responsible individual employee review request. So you'll upload any supporting documentation that the case manager may have received from the participant or the participant's PDS rep. And at a minimum, also you will upload the legally responsible individual's attestation form, which will be signed by the participant or PDS rep. And then other documents may include such as a doctor's letter, test results, behavior support plan, or documentation of attempts to hire other employees, or employment records for the legally responsible individual. No additional documents aside from the attestation are required, and then the case manager or case manager supervisor would select done when you finish any uploads. On the next screen, the case manager or case supervisor submits the request, and if there's any other details supporting needs to hire the legally responsible individual, please include those in the box. Adding details here, although, is not required. Once you're ready to submit, the case manager or case supervisor signs it by clicking the box and entering the case manager's first and last name, and then they click Submit Request. The legally responsible employee review request. There are 3 potential outcomes for the LRI PDS employee review. There is 1, a lack of information, 2, a denial, or 3, the approval. Lack of information questions those that will go back, the LOIs go back from the CHFS, DAIL, or DMS reviewer, and those LRIs go back to MWMA user who submitted the request. The reviewer will leave comments which are visible to the submitter. The submitter must use the response to the comments box to respond to the comments. The submitter can check any previously unchecked boxes but cannot uncheck previously checked boxes. LRI employee record request, lack of information, document upload. Once the document's upload screen, any reviewer comments will be viewable under the type of documents accepted as an other type. The done button will not be enabled until all documents are uploaded and updated on the screen box is checked. Once the LOI is resubmitted, the task will return to the reviewer. So for a denial, the case manager, as well as the participant or the participant's direct service employee, will receive a certified letter sent, as well as the case manager will also receive a copy, and which will include reconsideration and appeal rights and next steps. The legally responsible individual review request, participants' rights. The participant can appeal if the legal responsible individual is denied. The letter includes directions. Appeal requests must be sent within 30 days of the letter. Appeals are made to the Office of Ombudsman, and participants can request a reconsideration. DMS will review those reconsideration requests, and the case manager submits the reconsideration requests. For an approval, a letter will be sent to the participant and the case manager receives a copy as well as the hiring of the LRI or PDS employee, then can proceed. Here are also some resources. We invite you all to join us for a legally responsible individual PDS employee Q&A session for our providers on June the 21st from 2:30 to 3:30 Eastern Standard Time. And there will be also the link for that Q&A session, and you can submit those questions. For PDS policy questions, we have also provided contact information for DAIL, as well as technical questions. You can contact MWMA or our Waiver help desk, and then there will also be links for the PDS frequently asked questions, the legally responsible conditional employment letter, as well as the DMS PDS website, as well as the DMS LTS website as well. So that concludes our provider legally responsible individual session today. Kelly, I don't know if there's any additional housekeeping items that we need to share for.
No, just that I put some information in the chat, the date and time for the Q&A, as well as how to register for that. I know a lot of folks on here are probably already registered. And if that's the case and you have questions, you can just email those to medicaidpubliccomment@ky.gov, which I also put in the chat. There was a space in the registration to submit some questions, but I realized some people may have registered before this presentation and therefore before they were able to submit any questions. I did note there's just a couple of things that might be worth going back over. We had a request to kind of look at those categories again. So I was thinking, could you show us slide 13? And then maybe show us slide 21. And I think that'll help better connect kind of how that works. Okay, so there's 13. That's your two-step process for minors. So that first category is the first set of questions. That second category there is that category B is the second set of questions. And then maybe if you show slide 21, we can kind of show you how those things work together. So these are the questions then in that category A and B, like we showed you, and that they have to meet one in each. And April, you can, I think one more point of clarification that I'm kind of just seeing in the chat a little bit. For category A and B, they only are required to provide responses for whatever one applies, or you can put multiple ones. Is that correct?
Yes, that's correct. So at least one of the criteria in category A must be met, along with one of the criteria in category B. But if a participant's LRI meets more than one, I mean, please also demonstrate and document that as you work with the individual participant and the participant's PDS rep. So, you know, more information is always valuable to the reviewer, because the reviewer is only looking at the screen and they're not seeing the participant and the participant's legally responsible individual. And, you know, so please document and paint that picture for that reviewer.
So let's show just 14 and 21 as, or actually, no, go back one slide. So again, this is where we were pointing out here where this category A and B, when you get in MWMA, it's going to look like that. So it's going to look like all the 5 categories are kind of together. They are separate categories. I'm not sure why it's that way, but we will probably, I think, try to get it a little more clear in MWMA in the future. So just be aware of that when you're doing a child one in a, that you're going to have to, those first 3 questions are the first category. The second 2 questions are the second, like that category B. I feel like that's a little confusing for all of us. I think we were even, it took us a little bit to figure that out when we were putting the training together. And then if you want to go back to 14, so that's the adult criteria. Again, that's on one step. So I think that's going to be easier for folks, but so there's your one step for adults. And then I think slide 23 has the criteria. Sorry to be bouncing you all back and forth. So again, and same as the children, you would just, at least one of those you would need to provide information for, correct, April, but not all of them. Unless there was more than one that applied.
That is correct, Kelly.
Okay. A couple of just more quick housekeeping things, because I'm just seeing a lot of questions about this in the chat. We've had some folks asking, saying they can't see this particular module in MWMA. Those changes are going in later this month. So you will not see, if you log in today, try to start looking at it, you're not going to find it. That's okay. The changes are still coming. So a lot of folks asking about the reference guide. I put that in the chat, just referenced that there will be a reference guide that is still being worked on, but we will get that out to you all as quickly as we can before this process begins, so you can take a look. Also had a few folks ask about the presentation for today. We will send that with the recording. So you'll have this presentation. You also have the recording to refer back to. So you can kind of go over that again if you need to. And then some of the other questions I'm seeing, I think, are things that we will probably save for the Q&A / the FAQs. So I don't know, April, if you can tell us anything about that attestation form. Let's see. Okay.
I wish I actually had it. I did not have it available. What will ensure that we get that included in whatever material we send out with the DAC. We'll make sure that we include it. It's a very simple, that the participants is, what they're attesting to and uploading that into MWMA. It was just a 1-page form. I would say it's similar to those on the home and community-based waiver, similar to the KHAT signature sheet that is signed at the time of assessment, if that kind of helps clarify what it looks like. But unfortunately, I don't have it readily available, or I will share it at the moment.
Okay, so we will work on getting that out for you all. I know there was a little bit of confusion about that as well. Let's see, I'm just trying to scroll through and just think if there's anything kind of general. Again, some very specific questions, and we will get to those in the Q&A and again through the FAQ. Some very good questions. So thank you all for, I know, who are throwing those in the chat. That's great. And again, we will kind of take a look and make sure we're answering those during that Q&A session, which again is there in the chat. And I'm just seeing some suggestions as well. So we'll take a look at those to see if there's anything that we can adjust to kind of help folks. I think one other really important clarification that I'm just kind of seeing a little bit in the chat is just about who must go through the process. Again, this would be anyone who falls in that LRI criteria, which we showed at the beginning. This information is also in the FAQ, which I put a link to in the chat. It's kind of written out in there. So if you're wanting to go look at it, it is just people who fall in that category. So if you have a family member who is not legally responsible, who does not fall in that definition, they do not have to be reviewed. I know that's a little bit of an adjustment from the previous process, but so again, there's your criteria. That's going to be, again, we'll send this out, and that will be also it's in the FAQs right now. I know that for a fact. So that's something you can check out. Again, seeing some more specific things, we'll kind of try to get to those case by case / in an FAQ / soon. Okay, one more quick thing I think to clear up. Some folks are asking about the MAP 532 and having to upload that as well as add it in. You only are uploading that for somebody who was previously approved prior to 2020, correct, April?
Yes, that's correct. So
okay.
If the participant had already gone through the immediate family member review process that DAIL had prior to March of 2020 for the home and community-based or supports for community living, and they have that approved 532 approved letter from DAIL, that is what they will upload into MWMA to go through the offline process.
Okay. Okay, so I think that's kind of it on both. Let's see. So a lot of questions about Michelle P. LRIs. Yes, this does apply to them as well. So just trying to catch that general question there. I think that is pretty well it for kind of those more general questions. Again, we will kind of get to some of these other ones that are being asked that are a little more specific that maybe require us to go through and kind of just think through those answers and make sure we're getting you all good information and get those again in that Q&A. So please, 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 if you have not registered for that Q&A on June 21st, that link again is in the chat. If you forget, just hit up that Medicaid public comment at ky.gov email address. I keep a good eye on that and I will get back with you with that information as quick as we can. You can again submit any questions there. This chat I will download, so we will have these questions as well. So don't feel like if you put a question in the chat, it didn't get answered, we will get there. And again, we will get that FAQ updated as well, probably after that Q&A session, just because I am sure we'll get new questions between now and then. So I know some folks had asked about participants, kind of educating participants. So just a reminder, there is a session for participants this afternoon at 3 p.m. We won't go through that step-by-step process in MWMA, but we will go over the criteria, who's an LRI, you know, and kind of why we're doing it, just so they have an overview and kind of understand what's happening. That will also be recorded. I'll make sure that gets sent out to you all because I realize not every participant's going to be on there. Some folks have conflicts. So that would be a link that you'd be able to direct folks with questions to. One more quick just point of clarification. I know there were some people who are confused by the term PDS employer. The PDS employer is the participant. So the participant hires, PDS employer hires, that's the same person. So just some terminology there to kind of clarify. So. Okay, so again, just more general or just more kind of specific questions coming in. So I will go ahead. April, do you have anything? Got some folks asking about that Zoom link. I'm going to put that back in for you all. I know it's kind of the top of the chat, so it may have bounced out of your view again. So give me just a minute. April, any other anything to add before we kind of wrap up?
I do not. Again, we will make sure we get the deck out and the recording and the additional documents that we talked about. We will get those out as quickly as possible. And then also, again, we'll be doing the participant webinar at 3 Eastern today. And then also their Q&A session will be the 20th at 6:30 Eastern Standard Time. So they will also have an opportunity to submit questions and we will go through them. We appreciate your all's time today. We will definitely review the chat and work on any clarifications that we need to make. So Kelly, I don't know if we could leave the chat open for a few minutes. Yeah, if somebody thinks of something to submit, then please feel free to do so. So we'll leave the chat open again for a few minutes in case somebody thinks of something that they would like to ask or for us to clarify. And we appreciate you all attending today. Thank you so much.